All right, guys, I wanted to add to my collection of information, exercises, and solutions to back pain for you guys. This is Martin from downtown Ottawa at Reform Clinic, specifically expanding on the exercises and videos we've shot over the last couple months in regards to back pain. But today I wanted to give you some hands-on tips and tricks for managing your back pain. These videos are for information. You know, if you have a real back problem, get assessed professionally. This is not a cure-all for back pain, but I hope this does help you because there is a permanent solution to low back pain. You have to know what to do, and that's what I hope these videos help you with, because yes, if you have back pain, if you have a spine, you should be seeing a chiropractor on a regular basis. I mean, that's just a simple fact to adjust your spine. But the reality is you actually have to do exercises and look after your back on your own time if you want to live pain-free for life. The kind of back pain we typically see in the clinic fall in a couple different categories. So number one tends to be, you know, you slip and you kind of move and you get a sharp pain, like a jab or like a knife in the spine. It's kind of what it feels like, and that's incredibly common. Now, the other two, which are really interesting, is some back pain gets way worse when you sit. So, you know, 5 minutes is okay. 15 minutes, you're kind of getting a grumbly back, but then if you're there for 20, 30, 40 minutes, like you can hardly get up after that time. And this is going to be the subject of today's video, a back that gets worse when you stand. So you're doing okay in the first couple minutes, but you get worse the longer you stand until you need to take a break. And that's the reality of a gentleman I was speaking in here on Monday. So I wanted to give you specific exercises, but if you think about this, some backs get worse when you sit. Some backs get worse when you stand. So the really important thing is understanding what you need to do at home. So I hope this helps you guys, but definitely if you have chronic problems, you know, get a back assessment. Make sure you are doing the right things. Because I'm gonna start with, you know, hopefully you can understand the mechanics here a little bit. This would be almost a full size of me sitting here. Now, of course, when I'm standing, there's a lot more pressure on the back of the spine. So if we have problems back here, that's what we're going to help you with today. But if you have problems sitting, so you sit in the car or in the office and you start getting worse, that's a whole different story, whole different exercises. But what I wanted to show you was if you have problems standing, you know, whether it's back pain, you know, the hip flares up, you get chronic hip or sometimes even pain going down the leg, I want to show you guys two exercises and then some really advanced variations on one of the exercises to start taking pressure off your back, okay? So if you get pain when you stand, the first stretch you can do at home is very, very simple. Sorry. And what you're going to do, you're going to sit up nice and tall on a fairly hard chair. You're going to move yourself to the edge. And you're going to think about just slowly lowering your chin, your chest, your shoulders forward. And what you can see is you're starting to round out your low back a little bit. And with that, you can just slowly stretch forward. And you can just hold that for a couple of minutes. And this will serve to open up the parts of your spine that are typically going to get compressed and cause you pain when you're standing. So it's a slumping or a forward slump stretch, okay? So really simple. You're tall, you're squared up, and you're slowly bringing everything forward as far as you go, okay? And really important stretch, do things very gentle. Don't push through pain, and you're holding these stretches for at least 2 minutes. Usually around 2:15 is about perfect, but clinically anywhere from 2 to 3 minutes, you're going to get a great response if you have that kind of back pain that gets worse when you stand, okay? This is a fairly advanced stretch. The simplest stretch that I would show someone who does report that kind of back pain is like this. So what you'll do is, this could be a chair, couch, bed, something that's not incredibly high, but I'll show you what we're looking to achieve. Okay? I think that where I would start most people with low back pain that gets worse when you stand or when you're tall, this would be the most basic exercise I would start with. I'd see how it goes over the first couple of days, and then I would expand into the more advanced versions and also the seated slump test you just saw. So first thing I would ask you to do is, chair, table, couch, side of bed, is you're gonna lie flat on your back and you're gonna try and get your feet and your knees up to 90 like this, okay? What should make sense is as you put your legs up, you're actually moving your hips this way. And again, that's opening up your low back. So that takes pressure off the joints and the nerves in your low back, okay? So, and again, just like the first stretch, what you'd want to do is you want to hold this for two to 3 minutes max. And you'd want to see how that goes over a couple of days. And then if that goes well, what you can do is you can start bringing your knees a little bit closer, okay? Again, more opening of your low back. Try that for a couple of days, and eventually the goal would be to really pull your knees close to your chest like this. And again, you're holding for that 2 to 3 minutes and opening your low back up, okay? So there's a couple different variations of that one that start very easy, not a lot of traction or opening of the spine, but the more you pull those knees to your chest, the more you're opening your back. So for the people who are watching this who are more technically minded, I'm going to show you exactly what happens, okay? So when you're standing, a lot of pressure can build on the joints, the back of the discs, and the nerves at the back of the spine, okay? So I'll say right away, when you're lying on your back and you're bringing your knees to your chest, what you can probably appreciate now is you're actually stretching your spine in a way that opens up the back and takes pressure off your back, okay? So that's why when you start gently, it doesn't do much. Knees to chest, you're doing a lot. And I actually started this by showing you the slump test, slump stretch, which is a very, very aggressive way to open up all those elements in the back of your spine. So I hope that helps you guys. So basically, again, knowing what to do with back pain, because just because you have back pain doesn't mean you do the same thing. That's a really tricky thing about back pain. There's back pain that comes out of many different sources of the back. And of course, you have to handle them completely differently, because if you're doing these stretches for a different kind of back pain, like a herniated disc, you're actually going to make your back a lot worse. So that's why I said right at the beginning, these videos are for information only. You should get a professional assessment if you have chronic back pain. But for back pain that's diagnosed as getting worse when you're standing and it's properly diagnosed, these are the stretches that are going to give people relief and then building part of a healthy spine for permanent back pain, okay? So share this with somebody, tag someone who you think should learn more about this kind of pain. I mean, lots of people have back pain, and this helps them on their journey to keep well. That would be amazing. Take care. Martin signing off.